next up, we have Joanne and Ruth from our product team. They're going to be talking about the PKB roadmap for this year. So we're going to let this run a little bit longer as a session. We will still do some questions at the end, so please do pop them in the chat. But yeah, I'll hand over to Ruth and Joanne.
Hi, everybody. My name is Joanne, and I'm joined today by Ruth, and we're going to co-present our roadmap. So we're from the PKB product team. I lead the team, and Ruth is leading our user experience work. And we've been working at PKB for quite a long time. We're really committed to the mission of PKB. I've been working for 6 years, and Ruth's been working for 7 years. And to be honest, we spend quite a lot of our time focused on like what's coming next and what's in development. So it's been really nice to have the opportunity to come and to meet you all and to hear particularly how organizations are using PKB now, how it's been helpful for you, and to hear Fran's story as well. It was really inspirational to hear that. Even Mohammed, actually, there was things that Mohammed shared today that we've never heard in all of that time. So we've definitely got a lot of it today already. So hopefully we can offer you something interesting here as well. As I said, we're going to talk about a roadmap for 2021 and moving into 2022, what we know so far. Okay, so PKB we've lots of goals at PKB, but our core product vision at PKB is to create a single record for each person that is complete, real-time, and accurate. And so we've laid out our priorities for 2021 into 2022. And these are actually available on our main website. So wherever we have a reference, we've added that to the slide if you do want to go and learn a bit more about it after the presentation. So to run through these briefly, the first is having extensive third-party integrations. PKB has open APIs, and we're committed to offering full FHIR support. And as Mohammed mentioned at the start of the day, when we get particularly negative feedback from patients, it's usually because they don't have data available in their records. And when we get really positive feedback from patients, actually usually the data in their record that they're really happy about. So making that data available for patients is a real priority for us, and also making sure that the data can move wherever the patient needs it to move. And we're also working towards having a comprehensive and complete data model. So there are still data sets that PKB doesn't support, and we do want PKB to be a full health record for patients. So we're looking to support things like procedures and family history. We want to offer convenient and scalable onboarding. So we know that it can be difficult to get patients registered. So we want to make sure that there are multiple options for how to do this, both for organizations and for patients. And we want that process of onboarding for the patient to be clear and as simple as possible. And then finally, we're looking at making the system easy and convenient to use. This involves us focusing a lot on our usability and our accessibility with our user experience team. So this is a slide that shows our roadmap for 2021 into 2022, the things that we know about so far. There's a lot of things that we could talk about, and we can't go into everything in detail in time that we have. But it's one thing we do is every month we do publish a blog post which details the work that we're going to release, the new features we're going to release that month. And that's the smaller things that we're doing and also the bigger projects we're doing. So if you aren't subscribed to our blog, we really recommend that you do it. Ruth's going to tell you at the end a bit more about how to do it. So as I go through this, I'm going to talk about some of the projects that we're working on, things we've completed or we're working on or we're designing in each of those priority areas. And we're also going to talk a bit about the statistical data and the user research. So it's been great to see so far today that Neil and Jenny have already shared some of our stats reports in their presentations. And I know that Catherine mentioned that her organization at Hull were setting SMART goals to measure the impact of the PKB project. And we do really want to help customers to answer the questions that they have and have the data that they need to assess their projects. All right, first of all, looking at having extensive third-party integrations and working towards a comprehensive and complete data model. There are a few strands here I'm going to go through. The first is our integration with the NHS App, and then looking at our FHIR API work and talking a bit about the EMIS extract service. This year was quite exciting for us. We were the first personal health record to integrate with the NHS app and with NHS login. So if you are in the region now that you can get PKB in the NHS app, you can now actually access 9 different parts of your record directly from the app. So like medications, allergies, and diagnoses. And we have 2 more jump off points currently in progress. So this is for imaging and for sharing. The other NHS app project that's currently in progress is offering notifications within the app. So if patients get new data in their events and messages section, so that's messages, documents, consultations and events, they'll get a notification within the NHS app itself. In design at the moment, we have work to allow patients to add carers and then access the records of the people they care for within the app. So this is taking a bit of time. We need to design the pages to make sure that they're optimized for mobile view, to make sure they're accessible and they're following our new design principles. But this is currently scheduled for next year. Okay, so next I'm going to talk a bit about our work on our FHIR project. This is one of the largest projects that we have ongoing at the moment. Our largest team of developers is focusing on this, and we're committed to implementing full FHIR support. FHIR it's the global industry standard for passing healthcare data between systems. We really want it to be convenient and easy for organizations to integrate with PKB. Recently, we completed work to make a demographics API available, which will allow organizations to create records and update records, the demographics and records in PKB, and also add email addresses to those records. What progress now is the work we're doing to focus on adding clinical data to PKB. So we've separated the transmission and the storage of data from the aggregation of data, so that we can allow organizations to send FHIR data that they have into PKB without having to transform it, and we can store it. And then iteratively from there, we're going to work on aggregating that data and making it available in the user interface. So the first data sets that we're looking at here are conditions and medications and appointments. The other area we're looking at right now is questionnaires or consultations in the user interface. So at the moment, we recently made an API available that will allow you to get questionnaire responses from PKB if you want to pull responses back into other systems. And now we're working on an API to actually send questionnaires to patients. So this can be useful, for example, with patient-initiated follow-ups, where you want to check if a patient actually needs an appointment, for example, before they come in. And then finally, to talk about the EMIS extract service. So EMIS is a GP system used in the UK, and at the moment, when the GPs enter diagnoses, allergies, or medications into EMIS for patients, we are taking data into the PKB record, and we're also creating a record for the patient if it exists. And the next piece of work we're going to do here is to get physical health check data. So if a GP is assessing the patient, doing a physical health check with the patient in practice, that data will now come into PKB. We're working on supporting things like BMI, cholesterol, glucose measurements, alcohol and cigarette consumption, and that can be viewed in the record, or you could, for example, build a care plan around this and show it all within a care plan view. So the next priority area I'll talk about is offering convenient and scalable onboarding. First of all, here, this year, we've already worked on adding NHS login to all of our registration screens. So whether a patient is registering via token registration, the NHS app, or an email invitation, they'll also have the option to register using their NHS login. And this will register them for a record if they already have the record. It will actually create a record for them if they haven't had one yet. So at the moment, we are actually seeing about 2,000 patients every day creating their own record in PKB using NHS login. The other piece of work that we did recently to help with onboarding is we've expanded the HS7 API. So now you can invite patients that are outside of your org or your org network onto your team. Previously, that wasn't possible. And you can also add an email address to those records. So if you want to invite those patients, they can be added to your team immediately, and they can get access to your team resources such as care plans, library, etc. In 2019, we had 2.5% of patients with records registered, and through a combination of releasing this change, the NHS login work, and also customers' mass registrations, we now see that 10% of patients are registered. What's in progress right now? So we also want to think about the patient's experience of onboarding, and when a patient first logs into PKB, they go through a process where they see who they're sharing with and they learn a bit about PKB's privacy. So we recognize that this could be better, and we're trying to simplify it and make it more accessible, make the text simpler so that it's clear for the patient how to share and what our privacy model is. So that work is in progress. And the other thing that we're planning to do, which is upcoming, is send welcome emails to patients. So when a patient registers, we'll work to send them out an email which tells them a bit about their record and encourages them to log in and add data to their record. We're also making a change to the footer for patients who aren't registered. So at the moment, if a patient is registered and they get an email notification about some data in their record, we tell them to go find their link to register, but we're going to add in the prompt that they can also use NHS login if they want to register. Okay, I'm going to pass to Ruth and she'll talk about the next priorities.
Cool. So I'm just going to cover how the UX and UI team have been looking at making PKB easy and convenient to use. So one of the things that was reported to us from a few users was that adding data into their record was a bit cumbersome. So we kind of tried to collect all the different streams of feedback, whether that comes from our help desk, from our clients, we get quite a lot of feedback just coming in that we sort of collate in a log and review bi-weekly. And we kind of tried to identify what the problems were and how we could kind of improve them in a new design. And then we ran some redesign sessions with patients where we got them to use a prototype to carry out kind of like a test exercise of adding data to see how they found the new design. At the end of those sessions, we kind of took all their comments and further feedback. And there was, things that came up from it that we still needed to have clearer help text, that rewording some of the buttons, to make a bit more obvious what they did, kind of adding units beside fields. So things like that helped us to then tweak to a final design. So we've already completed the add test and add measurement. So it's a much simpler form now. They're optimized for screen sizes. It's meeting the accessibility criteria, and it allows users to add multiple data points at once. We're now currently working on the add symptoms screen, so that's due to be released in the next week or so. Again, they can search for symptoms, whilst previously it was just a long list of symptoms that they'd kind of have to scroll through the whole list to be able to save them. And yeah, they'll be able to add multiple symptoms at once. And then after that, it will be adding medicines. So there's a couple of sort of tweaks we're making anyway that we wanted to do to the add medicines form, but we'll be redesigning it so it fits all our new list styling, so it's accessible, works on a screen, and then users will be able to add multiple medicines at once as well. So one of the other things that's in design at the moment is it's an item that actually has come in from patients and professionals, I'd say in equal amounts, that they want to see a tabular view of test results. So at the moment, we graph all test results, and we'll show, any test result that you've had over a specific time period on one page. Whether it's, everything that you've had in the last 5 years. But a lot of people have said they would like to be able to see a list of results from a particular report on a day. So we'll have kind of 2 tabs, one of them to show everything and the other to show this kind of list view of results. So you could go to the lab report from, for example, in the screenshot from the 4th of September, and it'll have a list view similar to how you would get now maybe on a printout of a particular day's worth of results. So that's currently in design. And then making PKB accessible. So we did quite a substantial audit on the system to highlight where we weren't quite meeting the accessibility requirements for the 2.1 AA standards. So we did a more in-depth audit on our 10 most visited pages. We had a look through those issues, worked out what the biggest ones were, what order we wanted to do them in, and how we'd go about that. We also got all our front-end developers to undertake some accessibility training in the standards, and making sure that all new updates and design guidelines will include those, so that the new screens are all accessibility compliant. One of the biggest things that came out of our accessibility overview was that the current navigation in the patient view didn't quite meet those guidelines. It was something that we wanted to work on anyway. We'd had feedback that certain areas of PKB were harder to locate, but also that some users, and this became particularly apparent during usability testing, that some of our patients didn't realise that certain features were available to them. So it's something we really wanted to concentrate on, so that we're empowering the patients, to use everything within PKB and really interact with their record. So we've been working on a redesign for that, and hopefully it will help patients navigate the system, improve accessibility, and be able to highlight key areas and give them shortcuts to those. Whilst we're there, we'll also do the professional and coordinator navigation. So we've done some usability sessions on the coordinator view. There was quite a lot to work on from that. So we've kind of paused on the professional usability sessions, but hopefully they'll be running the next few weeks, once we've just done some more iterations on the designs. But again, that will be helping them navigate the system, grouping things together in key areas. So I've mentioned quite a lot of the usability testing that we have been doing, and I've sort of explained how we've done it. It's massively important in any software company that we get user feedback. Quite often it's easy to guess how someone would use the system or what they would think of certain buttons. So there's nothing that has greater impact than actually people coming and doing usability testing with us and giving us their honest feedback. There is a page on our manual that's linked on there, that allows anyone to sign up for usability testing, or if people don't feel comfortable doing that, there's also an option just to subscribe to our user research surveys, or there's an email address on there. So if people just have feedback that, that this doesn't work for our service, or as a patient, I find this difficult, I don't know how to do this, get involved however you can, because it really does help us make sure that the product's right for the people using it. And another way of getting feedback from users, we're actually going to be adding a widget for sort of short periods of time, initially for the patient screens, which will just have a brief survey kind of asking for feedback on particular sections or how easy they found certain functions. So that would just basically help us measure not only, whether people are enjoying using the product, what they think of it, but really highlight any issues that we might have that need resolving. And again, Joanne mentioned that some people have used some of these stats in their presentation, which is fantastic. But we've been working on these reports, and organisations can now have real-time access to those. And we're just going to keep building on those over the next couple of years. So there's a bit of information on the manual if you want to read what's available at the moment and what's upcoming. And lastly, again, as Joanne mentioned, we've got a monthly blog about our releases, and there's plenty of other things that come up in the blog. So please do sign up to our blog to keep up to date with those developments.